The role of surgical operation in cancer. Module content. Module outcomes. Aim of the module. What is cancer? How is cancer diagnosed? The role of surgery. When is the right time for surgery? Which one should be the first-line treatment, chemotherapy, radiotherapy, or surgery? The first-line treatment. The strategies in cancer treatment. The success of cancer surgery. What are the risks of surgery? References. Module outcomes. At the end of this module, the patient caregiver will learn about: to give information about the definition of cancer, understanding the role of surgery in the diagnosis of cancer diseases, to explain the timing of cancer surgery, neoadjuvant chemoradiotherapy and adjuvant chemoradiotherapy, to give information about tumor staging and its role in cancer diseases, to make the definitions of debulking and palliation surgery, to determine the factors affecting the success of the surgery, to provide information about the risks of cancer surgery. The aim of this module: informing the patients and their relatives on the surgical treatment of cancer, possible complications of surgical interventions, the factors affecting the surgical outcomes. Better knowledge on these topics is essential for successful outcomes of treatments. What is cancer? Cancer is a disease that occurs as a result of uncontrolled proliferation and growth of cells in any organ or tissue of the body. It is identified according to the affected tissue. More than 200 types of cancer have been identified. The highest mortality rate between cancer types are as follows: lung, stomach, liver, colon, and breast cancer. Cancer continues to be one of the most important problems of humanity. Treatment of cancer is possible with the collaboration of healthcare professionals with many different clinical research experiences. How is cancer diagnosed? There are many options to diagnose cancer. The diagnosis tools include various methods starting from simple blood tests to tumor markers, from X-ray scanning to more advanced methods such as computerized tomography and positron emission tomography. The diagnosis tools are selected according to the affected body part. For example, mammography for breast cancer, colonoscopy for colon cancer, endoscopies for stomach and esophagus cancers. Although surgery is generally applied to treat cancer, biopsies are used to diagnose the disease. The role of surgery. Biopsy provides detailed and certain information on cancer, such as the type, the molecular alterations, the spread of the disease, etc. It may be possible to completely remove the masses for diagnosis. If it is not possible, for example for larger masses, a small piece of the mass is taken and the diagnosis is made via the biopsy material. It is also possible to detect cancer after the examination of the material of benign surgeries. In these cases, the stage of the disease is determined. If necessary, surgical treatment is reapplied to complete the treatment. The role of surgery. Performing the surgery according to the stage provides better survival rates. Surgery to remove the tumor and the lymph nodes where the tumor has spread, which is possible especially in early-stage cancers, is essential to provide a disease-free survival. Staging is the basis of the treatment plan. It is also essential to create a common language around the globe for healthcare professionals and patients to understand how far the disease has spread. When is the right time for surgery? The most commonly used method in the world is the Tnm Staging System. In this staging, the letter T indicates the diameter of the detected cancer, the letter N indicates whether there is a spread to the lymph node, and the letter M indicates whether the disease has reached distant organs. Tnm indicates the stages of the tumor from stage 1, early stage, to the 4th, terminal stage, when it has spread to distant organs. Treatment plans are based on the stage. When is the right time for surgery? It is now known that surgery is more successful in early-stage cancer patients. In early stages, where the tumor does not grow very much and does not progress to the surrounding organs, surgery can provide a disease-free survival with or without additional treatments. However, in some cases, cancer is detected at an advanced stage. In this case, the role of surgery is limited. Although it is not possible to remove the tumor in some types of cancer, it may be advantageous to reduce it in size, which is called the debulking surgery. When is the right time for surgery? Additionally, surgeries may be performed in advanced cancers in order to maintain the vital functions. For example, if it is not possible to surgically remove the cancer that obstructs the large intestine, ostomy is applied to avoid the perforation and potential mortality. Also, a bypass is applied between the stomach and the intestine to preserve the nutritional path in advanced gastric cancer. The purpose of these surgical procedures is to enhance the quality of life of patients. These interventions are called palliative surgery. Which one should be the first-line treatment, chemotherapy, radiotherapy, or surgery? Chemotherapy and radiotherapy are important treatment methods applied in the treatment of cancer diseases. Although it varies according to the type and stage of the disease, it has extremely effective results with surgery. In some cancer diseases, the stage of the disease is detected in a period called locally advanced stage between the early stage and advanced stage. The first-line treatment. During this period, chemotherapy and radiotherapy are primarily applied for the disease. In this way, the tumor shrinking with treatment will be easier and more successful to perform surgery. This method is called neoadjuvant chemoradiotherapy. The first-line treatment. Usually, surgery is performed in the early stages and then other treatment methods are applied. This form is called adjuvant chemoradiotherapy. After the diagnosis and staging are made, first-line treatment is decided via the consensus of medical oncology, radiotherapy, and surgeons. The surgical procedures of each organ and each system has different variables. Interventions should be modified according to the patient, disease, and stage. With the developing technology, the equipment used has changed, the oncological features of the tumor are better understood, and thus more successful operations can be applied today. The strategies in cancer treatment. Cancer surgery can be performed with traditional or minimally invasive methods. Laparoscopic methods are beneficial since there is a lesser risk of infection, lesser pain and blood loss, faster healing process, and smaller, less noticeable scars. Robotic surgery is the most complex version of minimally invasive surgeries. Robotic applications enhance the quality of the surgery and minimally invasive surgeries prevent further damage in affected tissues. The success of cancer surgery. Surgery has an important place in cancer treatment. A curative surgical intervention is essential for better prognosis. One of the most important factors is the stage of the disease. The earlier the disease is detected, the more successful the surgery will be. Scanning methods are useful in early diagnosis. The surgeries are usually performed under general anesthesia. The duration of surgery is usually longer than for benign diseases since its complexity. Patients are admitted to the intensive care units after surgery. Advanced disease, poor general condition of the patient and the comorbidities are related to poor outcomes. The success of cancer surgery. Variables such as comorbidities and the drugs that used, the nutritional status, and effort capacity of the patient are closely related to the success of the treatment. Effective communication between patients' relatives and healthcare professionals plays a key role in terms of treatment success. Increasing the knowledge of the patient's relatives on cancer prognosis and treatments is essential to enhance the outcomes. This can only be managed with effective communication. What are the risks of surgery? Cancer surgery, like other surgeries, has many risks. Starting from bleeding and wound infections, there are also risks for worse complications specific to the type of surgery. For example, patients may suffer from anastomosis leaks after intestinal cancer surgery, or experience hoarseness after thyroid cancer surgery. Patients should be informed about all the possible risks and it should be ensured that the risks are fully understood. As the conclusion, cancer is a growing healthcare problem for both patients and healthcare professionals. Surgery is one of the most effective treatment options. The knowledge of patients' relatives plays as a key factor in cancer treatment. An effective communication between healthcare professionals and patient relatives is essential to enhance the postoperative outcomes.